It's, but no, seriously, memes have helped me in the worst times. It is stupid. Like, it is stupid how much memes I've consumed in the past, like 4 or 5 months. Usually I'm not that much on Instagram because I'm more of a IRL person in real life, right? I like going out. I like hanging out with friends. I like taking like 4-hour car drives. It's so cool. But suddenly you cut this all away from me and I'm just like, what's the closest thing that's fun? Ooh,
memes and video games.
All right.
It's amazing how many people just love, they feel like a meme like perfectly captures how they feel and what they want to communicate. It's so I even feel that way, but I find like even the younger generation, I'm just so impressed. I'm like, you can literally communicate so much through this meme.
Like one meme. Yep. It's no joke. Like, it's actually like, it's, I don't know. What makes memes so funny, you guys? That's something I never really thought about. Like, what makes it fun? Is it the relatability of the thing? Is it because it's genuinely funny?
What makes
I think it's like sometimes for me, like sometimes a meme says what I feel like maybe societally and culturally I can't say.
Yeah,
I see. Yeah.
It's like funny because it's true.
Yeah, it's like a loaded
meme. Because it's true, pretty much. Yeah. All right. So since we have you here, there are a lot of questions I wanted to ask. Ladies and gentlemen, we are about to go dark. Okay. So I had a friend once who was very, very like depressed to the point where they actually tried to, end it all. But luckily, this was before I met them that they did this. So sometimes I just sit and I wonder, like, why do people talk about suicide like it's completely unpreventable? Like, once you've reached that point, like, I don't know how to ask this question in a nicer way, but like, you feel like when they talk about their experiences, it's as though they're upset it didn't happen. They're upset that it didn't work out when they tried to. So why, like, how bad, like, not how bad, but like, why does this happen? Why do people talk about depression and suicide like they're lost cause and hopeless cases?
So I don't know if I'm exactly answering your question. So
It's fine.
Because I think it's a bigger, there's a lot, there are a few questions in there, I feel like. But I think that, oftentimes when we feel depressed or depressed to that extent where we're considering, ending our life or harming ourselves, usually that's a point where we do feel helpless and hopeless, right? It's hard to imagine other perspectives, even or other options, right? Even if there are other options, when we're in that depressed state, it's hard to identify those things, right? And I think that, when there is treatment, when we're able to work alongside someone who can give us treatment for not only depression, but help us in seeing, okay, what are some actual other options? Why would I not want to consider harming or killing myself? What are things that I could do to help me to feel better? Then we're able to, we're able to sort of perceive that option as like, not as something that we would actually consider. Do you know what I'm saying? Like, I think that there's like research that's been done that people who do after they get treatment or after they, attempt to harm or kill themselves, they actually do, wish that they would have gotten treatment sooner, right? So a little different than what you're sharing. And they both can be true, but I think that this is something that is preventable. And so if anyone's listening to this and they're finding like, I am having thoughts I don't usually have, or I'm considering these things that I've never considered, or maybe it is something that you've always considered, right? I really want to encourage them to reach out for treatment, because this is something that can be worked on that really is more speaking of like that depressed state that they're in versus necessarily that they want to harm or kill themselves. Do you know what I mean?
Yes.
Yeah, I get you.
Yes, reach out to treatment. Like, how so? So like, let's say you're in Kuwait or in whatever, Lebanon or whatever.
Yeah, so I don't know.
Facilities.
I'm going to be honest, I don't know what the treatment looks like there, but what I would I think off the bat, and I'm curious, Ali, if you can share with us what it would look, but I know even here, there are like cultural centers that, for people who maybe don't feel less comfortable in reaching out, there are cultural centers who they usually have someone who's trained with a mental health background. So they may not be a psychologist, but they're someone who maybe is easier for them to reach out to, right? Because they're within the community, and it's not necessarily a psychologist, right? And we also have hotlines that you can contact that are completely confidential. What I would also share is that if you ever reach out to a therapist, it is confidential. There's obviously limits to confidentiality, and one of them is risk of harming yourself, but it's always confidential. Like if any step is taken, it's always taken for that person's safety or well-being. And so if there's any worry of like other people in the community finding out that I'm in therapy or my family finding out, that's not, it's a confidential service. So we don't even confirm if you're in treatment.
Sure, but that's in the States.
But like
that's
here it's a lot different.
How is it?
There's this, I don't know how to explain it in English, but I'll try my hardest. So I don't promise you will understand, but if you do, hey, my English is just that good, right? Okay, let's get into it. Here it's a lot harder to go to a therapist unless you have like an actual like medical or like a psychological instability that's medically proven. If you're just going because you're missing that emotional help, or you do feel like you're a bit depressed and having these kind of dangerous thoughts, it's harder to reach out to a psychologist or a psychiatrist. Why? Because the stigma around it is very big. Very big. Like, oh, it's her parents' fault, or it's his parents' fault. They didn't raise him right, or they're not showing him the love that he needs, or they're not buying him the things that he wants, or they lack the comprehension of the fact that sometimes it's not because life has dealt them like crappy cards, sometimes it's just their brain has a chemical imbalance that puts them in these thoughts by force, not by will. So the understanding and the comprehension of this fact is very difficult in our society, because if there is something they can't explain medically, not because it's not explained medically, it's just they can't explain it medically, it must be a demon. He must be possessed. She must be just purely psychotic. He must be this, she must be, So they always try to find a reason. They never like to take, especially in our society, and not Kuwait, but I dare to say the Arab society as a whole, the Middle East. We don't like to take one step back, look at the problem, to take 2 steps forward and continue our way. I think that's the main reason. I hope you understood what I...
No, of course. Yeah, very much understood.
And yes.
Perfect, yeah.
So, you said like education, I guess, is important then. Just like
education.
Become more aware of all these issues, right? And
I think, sorry, I was just going to say like, I think about the education, but like having these, I think even having these conversations, right, is so important. Like this is such a, my hope is that someone listening to this will feel like their experience is more, normal, and they deserve the support, but also like within our own families, like within our own friendships, right? Like I think change really starts within our immediate circles, because like even in the Middle Eastern countries, so many people fall differently than where you and us three may fall, right, on this topic.
Sure.
But how about, do you feel like with the younger generation, Ali, in Kuwait, like there's more of an openness to mental health?